Hi, my name is Dr. Greg Doerr, and a question was just asked me today as to why it is that I use things like a functional exercise or a functional movement exercise rather than doing something like a basic exercise like a bicep curl or maybe just like a supraspinatus lift. So one of the big reasons that I utilize more functional exercise in my office, and we do a lot, it's not that we've eliminated things like eccentric loading for maybe an Achilles tendinopathy or a supraspinatus tendinopathy or a Tyler twist for a lateral epicondylopathy, but when functional movement patterns, especially from a training perspective, are much more important in reestablishing motor pathways. So it's great that you actually remodeled that epicondylopathy associated with collagen synthesis, but the reality is it's a focal injury, focal lesion, and you're targeting that specific tissue. With a functional movement exercise like a squat, or possibly like bear crawls, or deadlifts, or things along those lines that we do with CLX bands, wall angels, or Brugers, we're training more movement patterns, actually fascial lines, muscles that all work in conjunction with themselves. So you're not doing individual muscle treatments, you're actually training an entire pattern at one specific time. This allows you to actually incorporate your rehab into multiple body parts, multiple groups, rather than just doing a single body part. It allows you to work a little bit more aggressively in your office. Now, one of the challenges that you may have, and what I think practitioners sometimes do, is progress patients way too quickly in some of these functional movement patterns. A person who can't do a squat properly in gravity shouldn't really be doing a weighted squat. Somebody who can't do a deadlift just lifting up from the floor using a broom handle shouldn't really be doing a weighted deadlift. So one of the big issues that we have is progressing our patients a little bit too quickly through some of these movement patterns, even from a resistance perspective. I know when I first started in practice, it wasn't very uncommon for me to use things like the black, the silver, the gold TheraBands to train a lot of my patients. They were sport specific, they were a little bit more strong, they had a lot more endurance in a lot of the activities that they were doing. But the reality was I wasn't really training the proper motor pathways because they couldn't possibly use that heavier resistance on their motor pathways. So nowadays what I'm doing is I'm using a lot more of that green-red CLX and at times moving up to the blue CLX for more of my movement pattern exercises, making sure they can actually do the exercise neurologically sound before I progress them and now start training for strength and or greater endurance through those exercises. But the end all be all on it is functional movement patterns are better ways to neurologically stimulate the body and to train those motor pathways in a much more effective way.